Healthcare Center Committee meeting, recorded September 30th, 2020.
It is 5 o'clock. We will call the meeting of the, I was going to say Solid Waste Board. Nope. Sorry. The Healthcare Center Committee to order. And I just want to, before we proceed, I want to make sure that's noted that we do have a quorum here in the room. We have Supervisor Neville, Supervisor Robbie. I don't know that we have any board members on, or committee members on the phone call, because I don't see them by name. So we have someone, Galaxy Tab A, I don't know who that is. And then we have another person identified as community member, and that's fine. And then I have a telephone number, 715-340-5257. I don't know who that is. If any of those that I called out just now are committee members, please speak up. All right, we do have a quorum despite the fact that we do not have a full committee for this very important discussion. So I'll get back to reading the agenda. Again, please, if those online, when you're not speaking, please mute yourselves. I will try to pay attention to any comments that show up in the comment box or questions, and try to accommodate as best as possible. And also those folks in the room, to make sure that we are trying to get everybody included. I will read the public notice, which is the next item on the agenda. Members of the public who wish to address the committee on specific agenda items must register their request at this time, with such comments subject to the reasonable control of the committee chair as set forth in Robert's Rules of Order. Anyone in the room want to speak to a specific agenda item, or just allow? Yes, as we typically do, raise your hand and we will try to include you. Yes, Lisa?
Just allow to comment, please.
Absolutely. And when we comment, because we are being recorded, again, our thanks to the City of Stevens Point again for allowing us to use this room and to use these technology accommodations. Anyone in the room who wishes to speak will need to come to the podium and do that, so that Casey is able to capture all of this on the recording. And those folks online, please, if you have questions and comments, and feel free to enter those questions or comments into the chat box. I will try my best to accommodate that. And so moving forward, approval of the minutes. We have minutes from our September 16th, 2020 meeting. I would entertain a motion.
So moved.
Motion by Robbie.
Second.
Second by Neville. Any changes, deletions, alterations? Hearing none. All those in favor, please say aye.
Aye.
Aye. Anyone opposed would be no. Motion carries. Thank you. We have no special meeting attendance, so we will dispense with item 6. We have no correspondence, and because Michael Loy, the Executive Director of North Central Healthcare, is on the phone and he has a 6 o'clock appointment in downtown Wausau, I'm going to ask that he go first. And for context, for anyone listening who wasn't at our last meeting, one of the suggestions and the discussion from the last meeting on the 16th was the discussion of regionalization with North Central Healthcare, so Marathon County and Lincoln County. One of my action items coming out of that meeting was to reach out to Michael Loy and see if he would come and provide some context about the work he's been doing, not only with Marathon County and Mount View Skilled Nursing Facility, but Pineview Nursing Facility in Lincoln County. So Michael, I know, thank you again for being here. I know you got a busy schedule, but I would love to hear from you again. What what your experience has been. You visited with us a couple of times, but if you could just kind of bring some context. I have new committee members, and the background you bring is going to be really important. I suspect they'll have questions. So I will give you the floor, Michael.
Thank you, Supervisor Johnson. Can you hear me okay?
Absolutely.
Great. Well, if Marcia and Lynn are in the room with you, tell them that I appreciate all they're doing. I know it's a whole new world out there, and I'm rooting for them and as many other nursing home operators right now. It's a tough go, and I think I can distinctly appreciate all the challenges.
And they are in the room, and they heard every word you said.
Well, I'm rooting for them. So great to be with the committee tonight. I know I haven't met several of you because of the turnover in the committees, but it's my pleasure to be with you. It's been about a year since I last talked with Portage County in a kind of formal discussion relative to the nursing homes. And it's felt like a career ago since I was last there, given all the things that have happened over the last 18 months or so. Last time I was with Portage County, it was really around two things. It was to talk about the process that Marathon County went through to revisit whether or not we should remain in the nursing home business. That process took place now probably 3-4 years ago at this point. And as we embarked on that process, we evaluated 3 questions: whether we should stay in the business, whether we should close, or whether we should sell, which is very similar to the question in front of Portage County. And relative to the situation we were in at the time is very similar to Portage County, which is we had an aging facility, a declining census, and an overall challenge as it relates to the financial proposition of running a nursing home in the state of Wisconsin. And through our process that we embarked on here, we were able to reaffirm the role and the importance of counties maintaining nursing homes, and then came to a decision not only to stay in the nursing home business, but found a way to invest in the way that we needed to be successful and build a new facility here on our main campus. And that was something that preceded our $73 million renovation project. And right now, we're in a process of developing our new 96-bed skilled nursing tower that continues even despite the pandemic. And we're very excited about that new building opening up next summer, and the further renovations that we're going to have as a result of that. The other element of our discussions over a year ago was the value proposition of potentially working in a more regionalized manner to keep county nursing homes viable financially, and then be able to create opportunities for us in the future by working together to share resources and to have a stronger market presence to make sure that we can have the necessary referrals and census to maintain a stable operating model. And so we started to talk about what that would look like. And at the time, I encouraged the county to embark on its own process, similar to what we did with Marathon County. And I think at that point, I had offered a connection to Michael Pierre and CLA as a firm that I would highly recommend and that we went through in our own process. And I've read the report that Michael's put together for Portage County, and I think he's done another fine job and really articulates not only the marketplace, but the issues that are pertinent to the decision you have in front of you. And part of that is the regionalization element for you to consider going forward. In the intervening time, what's happened for us at North Central Healthcare, and North Central Healthcare is a community service organization that's owned by Langlade, Lincoln, and Marathon counties. So we are fundamentally a governmental agency. We are separate legal entity from county governments, but we are owned and operated by county government. And since we last spoke, one of our partners, Lincoln County, who operates Pinecrest Nursing Home, that is a 180-bed skilled nursing facility, had their nursing home administrator announce that she was retiring and asked us to move in to provide interim administrative services for Pinecrest. And we had been in similar discussions with them about regionalization. And we said that we'd be willing to do that if we could take a hard look at how we could regionalize and work together and eventually and potentially take over Pinecrest operations. So we assumed the administration duties of Pinecrest Nursing Home in April, May of that year, and then went through a whole process of evaluating whether or not regionalization made sense. At the time, Pinecrest was again managing a declining census. They had infrastructure needs. They had just completed a renovation of key areas in their rehab and dementia programs, but their traditional long-term care census was declining, and their financial position as an organization was pretty dire. They, to me, probably had about 18 months of operating before they were going to be bankrupt. And they were operating at about about $1 million loss in the red for a couple of years, and that proposition looked like it was going to continue. Through our analysis and our ability to work together as an organization, we were able to arrive at providing a management agreement with Lincoln County to take over operations of Pinecrest Nursing Home. And we believed that we could do that and turn them into a profitable nursing home, or at least a break even, and that's the goal for us, within a year or two. They signed that agreement in August of last year, and we transferred 200 employees in the 160-bed operation by January 1st of that year. So in about 4 months, we were able to turn that over into our direct oversight. And I'm going to tell you, I won't do that again. But it was a pretty substantial lift, and it went really well. The first priority for us in that transfer was to work with our employees to make them feel comfortable with the transition, to address, the questions they had around wages and benefits. And I think, that went about as well as it could have went. Honestly, we had a lot of good meetings, with a lot of good interactions with our employees up there at Pinecrest. And, there really hasn't been any significant challenge or issue that's arisen in the transfer related to bringing 200 new employees a part of North Central Healthcare. And I think in a large part, it's really benefited them, and they have new supports and resources that they didn't have before, in kind of this healthcare operational model that I think that they're valuing as we move forward. The second major priority has been technology. We had hoped for a 1-1 cutover on technology. We had to get all of those individuals on our network. We had to assimilate their electronic medical record, which is different than ours, and many of their employees never even had email. So getting them access to email, getting them access to our electronic systems in terms of occurrence reporting and quality, and some of our resource management technology was a lot of work. We were able to do that successfully. And then lastly, we've been working on the pharmacy transition. As I think I highlighted last time, we have our own pharmacy here and pharmacist. That last piece of the transition occurred in July of this year. So we fully transitioned laundry, pharmacy, everything. And now the transition has fully been completed about 9 months later. And I can tell you, the budget we were able to put together for this year had us eliminating their operating deficit within year 1. It was a win-win situation, not only for Mount View Care Center or North Central Healthcare and Pinecrest, but everybody really benefited from that in terms of the operating model. And certainly we've been able to be successful, even though census has continued to decline, due to unique kind of market dynamics in Lincoln County. They have a huge long-term care population that I think will continue to dwindle and move to more assisted living type environments in the future, as the managed care organizations move people more into community-based options in those assisted living type settings. So we're managing that. We're able to manage that successfully. Of course, workforce demands are also a major driver of the size and scope of nursing homes going forward. But we've been able to do that successfully. And even with the challenges of COVID, with the governmental funding that's been available through the CARES Act, everything continues to remain pretty green lighted in terms of overall operational success. And I think that Pinecrest has been very appreciative, and we couldn't have been in a better position to support them going into this pandemic. I think the resources that we were able to extend into their operations to support not only the preparations, but the management of outbreaks, testing, and protective equipment for employees, and making sure those resources were available. I think it would have been a completely different situation had they been on their own relative to that, with the new administrator and a new DON. So by and large, that's been very successful. And so, tonight I just really wanted to talk about, the progress there, and then kind of reaffirm our interest and continue to work with Portage County in any potential future situation. I don't know what that looks like, and certainly as I read your report, that's a consideration that you have going forward. I think that our organization offers the ability to help navigate not only the question of whether or not nursing homes should be in the business and continue to stay in the business, and what does that look like in the community. And each of our 3 counties have distinct marketplaces that are different, and that our considerations are there. But our goal is to remain viable, to continue to have counties operate these very important services for their communities. I think there will be the have and have-nots as it relates to counties that have nursing homes versus those that do not here in the future. But I also think that we need to transition nursing homes. Nursing homes in the traditional long-term care sense that most of us are familiar with won't necessarily be that way in the future as technology and more options in the community continue to proliferate. But there is a special place for us, and that a need is going to continue to increase, and we have to think about how we integrate more physical and behavioral health care into the long-term care setting to prepare for higher medical needs for patients that are coming in, end-of-life care, and more specifically, importantly, and uniquely to North Central Healthcare, certainly is behavioral health care and the long-term care needs of our behavioral health care population. And so it's preparing our workforce and preparing our organizations and facilities to do that. I can tell you managing the facility renovation process is intensive in terms of the design, the construction, and then the coordination of the resident moves and the certification process. I think that's certainly something that, if we're able to work together, we could help with the expertise in the future. But more than anything, it's about positioning our nursing homes to be successful by working together, sharing resources where we can. Obviously, with the success we've had with Pinecrest in a very major transition, is evidence that we can do this successfully and continue to provide services at a high quality and certainly at a level that is viable for counties going forward. And then be able to also invest in those facilities and operations, which I think is important for us to be successful going forward. I can tell you that the changes that we're making as it relates to higher acuity medical care and certainly behavioral health care does challenge nursing homes in terms of regulatory challenges. There are things about nursing homes that make it difficult when you have behavioral health populations within your nursing home as it relates to some of the quality measures and psychotropic quality indicators that you are beholden to. So, we've had, as we've been transitioning, I think that's one of the major challenges that we've had is that how do we do this and do that in a way that, make sure that our quality indicators stay high, fairly represented in not only our reimbursement, but then our certainly our quality indicators going forward, because it is a whole new operating environment that challenges nursing homes. And then also the other major thing that's really kind of pushed on us is COVID. And there's a lot of things that COVID's impacting certainly, but as it relates to nursing home, I just want to touch on a couple of different things that I think are important for us to consider, going forward and certainly, entertain a discussion around that. First, COVID is impacted us in the short term in terms of our census. People with private insurance, rehab, or the ability to choose where they want to be are choosing to stay at home as long as possible. If they have to come into the nursing home, they're staying as short as they can because of the fear of being really locked in, for the lack of a better word, in terms of being at risk of contracting COVID in these congregate settings that have shown across the nation to be high risk. I think our nursing homes in our region have done a great job in protecting our residents. I don't know what the experience has been relative in Portage County, but we've had outbreaks here in Mount View and at Pinecrest, and we've managed those very successfully. Nursing homes are a petri dish for a virus like this, and it's very difficult to stay out in front of, but it's been remarkably successful even given those challenges. But COVID, I think, has forever changed and accelerated trends that we are already experiencing in the nursing home, where the generation that is getting set to consider long-term care options that are in the next 10 to 20 years are going to generally orientate themselves to staying at home as long as possible. I think technology will continue to support that, and our traditional long-term care population will continue to be smaller. What needs will continue to be unmet for us as communities will be those higher acuity medical populations in our rehab, and certainly our behavioral health patients, which are both recommendations in your report, but I think those will only grow more and more as we go forward. The other implication of COVID is that it's stressing nursing homes substantially. It's going to stress them financially here in the short term. I think the CARES Act has helped. It's helped keep the doors open in some nursing homes, but I do expect a wave of closures once that funding runs out in the next, probably 3 to 18 months. You'll see a number of operators go out. They'll stay in the business to capture whatever funding they can relative to the federal funding opportunities that are out there, but we will start to see nursing homes close. And then going forward, I think COVID will dramatically reshape the regulatory environment that impacts nursing homes. And for buildings like yours, much like ours, the ability to even have semi-private rooms, shared bathrooms, and inadequate HVAC and other things are just not even going to be permissible. And so, it's going to be something that we're going to have to comply with in the future. And I think the regulatory burden of nursing homes are going to get, pretty substantial here as a result of some of the things that we learned from COVID and how to keep those residents safe in pandemic type situations. And so those influences are going to push people out of the business because they're just not going to be willing to put the money into the facilities. And they certainly are fearful of their ability to be successful. And that's going to leave county nursing homes as the option of last resort in some cases, in some communities, and then certainly, in the cases of our region, we have great reputations, and if we invest in our facilities and continue to offer these things, not only will we continue to have access for our community, which will be important as other facilities close, but our ability to provide high quality care affordably will put our communities out ahead in terms of responding to the needs of our senior population in our communities. And there will be haves and have-nots in the state of Wisconsin and nationally relative to what we see here in the next several months. As it also relates to the size of nursing homes, I think that as we go forward, we cannot, make it an insignificant consideration relative to what the available workforce is. As we led into the pandemic, 1 in 5 caregiver positions in the state of Wisconsin, on average, were open. As we've gone into the pandemic, that hasn't changed much. As we deal with staff that are dealing with quarantine, positive cases, and that are subject to testing, that's only further stressed the workforce capacity that we have in caregiving in Wisconsin. And I think there are a whole host of people that will see it through. But on the other side of this pandemic, we'll reconsider their career decisions relative to wanting to work in the long-term care industries. And so as we think about our buildings and our operations, there are 2 predominant factors. One is, what does the market want in terms of the size and scope of the nursing home? And then 2, what's our ability to staff it successfully? And I think those are really key considerations. And as I look at your study and what's happening in Portage County, I think you are a very important resource to your community. I think I have a note in here that your competition is yourself in many regards. And I think going forward, relative to the other, facilities in your community, whether they change in size and scope or go out of business, I think that you will have a very prominent place in your community, and to reinvest in your facilities and to change your services to be more focused and orientated towards behavioral health and higher acuity medical and end of life care will position you to meet the needs of the community successfully. And I think it will separate Portage County from other counties in the state of Wisconsin in terms of what you offer your residents and potentially any access issues that may come with demographic switches in the next 10 to 20 years with that 65 plus, 85 plus population growing. So that's kind of how I see, kind of the overall landscape of skilled nursing facilities, what we're navigating here. Again, I really remain interested in working with Portage County. I think we can certainly help with supporting the organization from a support standpoint. Nursing homes are difficult businesses to run. They require a lot of resources, a lot of skill sets and supports. And I think our evidence in Pinecrest is that it benefited both of our organizations. Pinecrest substantially more than North Central Healthcare, but North Central Healthcare definitely had some positive benefits out of it as well. And as we all continue to change the size and scope of our nursing homes, it helps us rebalance, have the available talent that we need in terms of support structures, and then be able to share investments and create capacity to have investments in technology and facilities. And again, we've really evidenced that by our work with Pinecrest. So that's just kind of a quick update on what we've done over the last 18 months. Again, as I was a year ago, I think you guys have a great opportunity to be successful if you reinvest in your facility and technology. If there's an opportunity for us to work regionally, I think for us to at least do the analysis of that and look at what that means for your organization and ours is a good thing. I can tell you that I did the necessary legwork on our side to be able to even consider working with a county out of our 3-county partnership as it relates to our agreement with our counties that would allow us to do that if we wanted to in the future. So there's really no impediment for us to do that from a policy-making standpoint. It's just whether or not it makes sense for both of us from an operational and financial standpoint to work forward in the future. And I do think there's a lot of inherent benefits in that. And I guess at this point, I would just like the opportunity to look at that more in depth, given that you've done your own analysis relative to your operations, and take what we've done and you've done and look at how regionally we can maybe make that even better and help support you guys get to a new facility and ability to have a strong viability going forward. So happy to answer any questions that you have. Hopefully what I hit on tonight was relevant in your considerations, and we can continue the discussions.
Thank you, Michael. And I know you've got to be downtown by 6, so I think you can maybe take a few questions.
Yep, I got 15 minutes or so.
Yeah, it depends how fast you go down Grand Avenue. So questions from the committee for Mr. Loy.
I have some quick questions. You mentioned that prior to your movement that your deficit spend about $1 million per year at the healthcare center, and the projections were that that was not going to improve dramatically. Is the county currently giving any dollars towards the healthcare center, or are you now financially solvent?
Good question. So Pinecrest up in Lincoln County has a tax levy subsidy of about $400,000. Mount View has a tax subsidy of tax levy subsidy of about $1.5 million. And that's based on both of our Medicaid mixes. Portage County has a better mix, I think, and a potential to further improve that. So I think you're probably, in my opinion, the best positioned out of the 3 to be successful at looking at what that means long-term for tax levy.
And is that going to be long-term, or are you hoping that at some point the county is not subsidizing the healthcare center? Is that the goal, or is that reasonable, or do you think that those numbers are going to kind of continue and possibly escalate?
Yeah, I think that's always the goal. There's a lot of philosophical and policy decisions that lead into why we're financed the way that we are and how that's changed over the years. I think the ability for us to maintain a stable census, a healthy mix of positive payer sources, and then for us to be able to change how we operate and have facilities that attract people to them will make us viable in the future. I do think there'll be an opportunity for that, but right now it's so hard to say exactly what's going to happen. But I do think that it will improve. I do. That's our goal, and I think it'll improve.
The $73 million renovation, how is that financed? Is that a referendum, or is that?
Yeah. So
what happened with the mill rate there?
Yeah, no, that's a really good question. So both at Pinecrest right now, we're servicing, I can't remember the total amount of debt, but they borrowed $10 million to do the renovations, and we're funding that through operations. So yes, we're still subsidized by tax levy, but we did not have to borrow money from the taxpayers to be able to do that bond repayment. We're doing that through operations. If our census mix improves, now, we've been dealing with the declining census due to COVID, so it's kind of been a new new environment a little bit. But prior to that, we were trending towards the ability to not only pay the debt, but start to look at whether or not we continue to maintain the tax levy at its current rate. But the same is true at Mount View. We have the $1.5 million in tax levy, but our financial pro formas for the $30 million or $35 million that it's going to cost for our renovations for Mount View will be able to be financed through operations. So we will bond through the county, but we will fund it through operational improvements and be able to maintain, if not improve, the tax levy payment from Marathon County for our operations, if that makes sense.
Before, would you clarify, the 78 million was for or 73 was for Mount View and North Central Healthcare?
Yeah, that was Mount View and North Central Healthcare. The part that was for Mount View is somewhere probably going to be about 30 million that's specific to Mount View. So not the full $73 million project, but about half of it.
One last question, I'm sorry for taking time, but.
And Dennis, if you could speak up.
Yeah, sure.
People online were having trouble.
Do the employees, when you transfer them over, were the employees able to retain their benefits?
Well, they remain in WRS, so that was seamless. The benefits, there were some things that were better. There were some things that were a little worse, but by and large, we did a really great job in making them whole as we probably possibly could have in terms of sick leave balances that they had. And that was probably the biggest issue that we had is we had a pretty substantial difference in sick leave benefits. But we were able to essentially fund and pay employees that liability and then transfer some of it over to fill their other balances. And, there were concerns at the onset of that, given the differences, but I think we handled it about as good as you possibly could have, given the situation and the liability that the county had incurred. And I think that, by and large, the employees were very happy. We had probably 2 or 3 only people retire before the transition so that they could capture their benefits, but it was pretty unique to their situations. But otherwise, we, probably retained, I would say 98% of people in the transition. Some people retired, but that was it. And people really, I think by and large, felt like it was pretty equitable. And that was our goal.
How do you respond to critics that say that you're taking services that could be totally private? I'm hearing that, and I just don't know how to answer that.
Yeah, it's a good question. I think that over time, we want to do things that other people are unwilling or unable to do it because, it's not as lucrative to them. I mean, we don't do a lot of hips and knees. We do things that are, more intensive in terms of rehab that other people might not take because of the financial risk or the pharmacy cost or stuff like that. And I think, we are trying to be the organization that can do that successfully because other people are unwilling or unable to do it. Ultimately, people in the community choose where they want to go to receive their care. And I think the choice is between, privates tend to staff not as generously as county homes. So the quality tends to be impacted by that. And then also, I think that going forward, private organizations are going to exit the market and the options are just not going to be as available. If private companies wanted to do all this and counties didn't have to be in it and we could rely on that marketplace to give us the adequate access for not only the general population, but those that are hard to take care of, then I think then we could not be in the business. But I don't think that's the reality today, and I don't think it's going to be the reality in the future. And I think counties are going to be responsible for these populations that are vulnerable and lack resources.
Thank you very much.
All right, other committee members, good questions. Yep. Make sure you speak up, Mildred.
I had a question regarding the analysis you mentioned. What's the scope of the analysis that's needed if you're going to, look at working with us?
Yeah, I think it's relatively straightforward because you've done the work on your own accord. So you have your information, Michael and his team did that work for us a couple of years ago, and we have to revisit that ourselves, given, what we need to estimate the impact is with COVID. When we designed our building, we designed kind of the upper limits of the census that we were projecting to not have as much of an investment in the renovations, so that if we had to scale it back, we could. And we may scale it back if we think that 176 is not good enough, but is not going to be what's realistic. But I think we have a lot of what we already need, and I think it's sitting down and looking at what we were able to do at Pinecrest, looking at the data from North Central, and then looking at the data from your study with Michael, because he did that work for us both independently, but similar processes. I think it would be relatively straightforward proposition. I've talked with Michael just in concept with that, and I don't know if he wants to add anything to that, but to me, it would be pretty straightforward and not time intensive.
Thank you.
Thank you. Other questions before Michael has to leave for an event? And all right, I waited the 3 to 5 seconds. All right, I'm sure we will be discussing this some more. I appreciate this, Michael. Again, I just admire what you've done, and I think it's a great model. So looking forward to hopefully working together. So
Great.
in some form. So, all right.
Appreciate your guys' time. Anytime you need me, I'll be back.
I know where to find you.
Thank you, guys.
All right. Thank you.
Bye.
All right. Moving on. Now is the second portion of Michael Pier's presentation, a little bit more in depth on some of the analysis. And Michael, if you wish, I'd be happy to share the screen with you. If you're still there. Yes, you're still there.
I'm still here. Sorry, trying to turn everything on. I was on mute.
Okay. And
Good afternoon, everyone.
good afternoon. I am going to, let's see.
So Melissa, I don't have anything to project tonight.
Okay.
Just discussion and talking
Okay.
about it. And, I don't know, even before I make any comments, one of the things I think that you'd asked me to be present tonight is just to answer. We presented a lot of information last week, and if there were any follow-up questions or things that individuals wanted to ask, I wanted to make sure we address those as well.
Okay. Wonderful. No questions? Mildred? So I think one of the things that I was looking towards is on the presentation, and I'll see if I can pull it up, or the report. And I have way too much stuff, and I didn't have it up. Very early on, there we go. And it should come up. So it's on page 4, the strategic planning approach. And, kind of looking into, phase 3 and phase 4. What do we need to do? I think we've done the planning and kickoff. We've done the phase 1, the phase 2. Kind of moved into phase 3. What are our next steps? What do we need to do to move beyond just getting together and talking about this, to move into that strategic financial model development?
Yeah, so I really think it's, we presented several recommendations during our last meeting. I think that was on the 16th, including, potentially a significant renovation of the current health center or a replacement of the health center, an understanding of what capacity. I mean, Michael touched on that. He wasn't even on our meeting last week, and he touched on dropping capacities. And would you want to include an assisted living, or at least explore an assisted living component to that, as well as the potential collaboration with Marathon County and North Central healthcare. In my mind, the appropriate next steps would be for this committee to make recommendations on which strategies specifically to explore, or I guess conversely, if there were any strategies that there were concerns about, that should be taken off the table as we move into phases 3 and 4.
Okay. So we've got to make some decisions, is what you're saying, correct?
Yeah. Certainly I feel like my responsibility is to make recommendations and help interpret the data, but this committee ultimately needs to be comfortable in making recommendations on moving forward and ultimate recommendations to the county board.
Okay. Anything from the committee?
No, thank you.
Okay. Anything from first the folks in the room? All right. Anything from anyone online? And again, I'm going to try to do my best. All right. Again, this was, I believe it's on the agenda as information to inform our discussions, and not an action item. We would have to bring this back as an action item, obviously. And if the committee so wishes, we will do that. I have no questions. I don't have anything in the chat box. I don't see any hands raised. I'm sorry it's taking a little bit longer. I just want to make sure, Executive Holman and Chair Haig, I see you're on. Do you have anything at this time?
I have nothing at this time. Thank you.
You're welcome. And apparently, Chair Haga is either on mute or has nothing to ask. Okay, so I think
have nothing to ask, Melissa.
Okay, thank you, Al. So the priorities of questions are the recommended questions that we have to answer. And I would say the first one is, do we remain in the market? If we do, what is our decision on a new facility? What would be our recommendation on amenities, including assisted living or other services that can help to offset costs? What would be our recommendation on regionalization? And what do we take off the table of any of the recommendations that we're not comfortable with? Did I capture that?
The only thing I would add is that if we're not going to be in the business, what is our recommendation?
Right, we'd have to, the state lays out a plan, we'd have to follow a plan.
So there are different options. One is just to close down, one is to.
Right.
Right. So
Right.
I think that we want to flesh that out. If that's going to be the direction we go.
All right, so does that sort of capture it, Michael?
It does. You said it very well. Yep.
All righty. It looks like I got an agenda, all the agenda items for our next meeting. So, all right, thank you very much, Michael. I appreciate you sitting through Michael Aloy's presentation or discussion, which you've heard many times before, and for joining us once again. I'm sure there'll be more questions. So thank you.
Thank you.
You're welcome. All right, moving on. I just have one question, is for the regionalization, and I guess I'm looking for the committee for some guidance. Do we want to see that as an agenda item for discussion or an agenda item for action to request? Because North Central Healthcare has already said they would pay for that analysis.
I think, Melissa, I'd rather have a discussion for the group to talk about of the options that we had from the beginning, those first 4 options.
Okay.
Are there any of those options that we want to drop completely?
Okay, fair
Are
enough.
those any options that we can all coalesce on, or are we going to have some split options that we have to go in two different avenues? But I think the sooner we start limiting some of those options, the,
Narrowing, yeah,
right,
absolutely.
yeah, I think
Yep.
that's good before we start focusing on any one option.
Excellent. Just wanted to.
Yep, thank
make
you.
sure- Yep, make sure I was heading in the right direction.
Melissa, if I could ask a question, please.
I was going to say, who the heck is that? But now I'm recognizing the voice. Yes, go ahead.
This is Ray
So the-
Reeser, and I am at a massive disadvantage here by having to phone in. Sadly, I cannot get the link to work. But my question would be, what are the downsides of actually listing regionalization also as an action item? That if it looks like it's one of the feasible options we might be looking at, what is the disadvantage of also listing it as an action item?
I think that's a good question, Ray. I think we could list it. If we don't get to it, we don't get to it. But if it's there, then we can take action. So excellent question and suggestion. Thank you. Anything else, Ray?
No, that's it for now.
All right, thank you. Ooh. Oh, geez. We've got music in the background. Oh, yes. Anyway, moving on. Item 9, discussion and possible action. Resolution approving out-of-sequence reclassification request for certified nursing assistant. I think you all had the information, had a chance to look at it. We've discussed this for a number of times. I'm not sure how we want to proceed with this. I guess we'd start by entertaining a motion and then we can get it on the floor.
Just a question though, isn't that something that the county executive already taken up as far as the budget? That's what I heard and you were part of that finance meeting.
Right. So Laura, yeah, good point, but.
I don't know, that's why I'm
Yeah,
asking the question.
good point. I'm following the policy, so.
That's what it is. It's following the policy because reclassification requests are due July 1st every year. This obviously was not submitted in that time frame.
Okay.
So there's a provision that allows for out of sequence, and that's why it has to go through all the committees, county executive and county board to be approved. Now, because of the timing, obviously, we would like to get it into the budget. So you can see when you find the reclassification request, there's an asterisk, and that will be in the budget book that says it has been put into the budget, funding for it, but it needs to go through the approval
Okay.
process.
Thank you.
Yeah, good question. I was following the rules for once, which doesn't happen often. Most people who know me know that. So, yes. So I would entertain a motion to get it on the floor and. So moved. A motion to approve?
I would second it.
We have a motion to approve and there's a second. Any discussion from the committee? We'll start there, which includes you, Ray. I know you're on the phone, but,
Sure, I can listen.
okay.
Just clarification, at the last meeting, I think of just some general numbers, I know that we caught people off guard with the question, but they thought it might have an impact of about 20-some thousand. I think the actual impact is about 80-some thousand, but I also understand that it would be taken out of the, the federal funds. So
No, not the federal funds. The federal funds are the hazard pay.
I'm sorry.
Yes, the referendum.
Yeah, I'm sorry, the referendum,
Yep,
correct,
yep.
and therefore I'm very much in support of it.
Okay.
Thank you for the clarification.
No problem, thank you. There's a lot of things going on all at once. Members of the public that are in attendance here who wish to comment? Okay. Anyone online or on the phone? Again, I'll look through. No one? All righty. Oh. And Nancy Rappi, you had a question about CLA, and I'll address that a little bit later. So we have a motion on the floor and a second. There has been no additional discussion to approve the out-of-sequence reclassification for certified nursing assistants. All those in favor, please say aye.
Aye.
Aye. Anyone opposed?
Aye.
Thank you. Anyone opposed would be no. Motion carries. Thank you very much. I'm assuming, Laura, this goes to HR and Finance. Is that correct?
Correct.
I made the resolution correctly. Awesome. All right, moving on. Update on the hazard pay for Director of Nursing, RN Manager, MDS Coordinator, which I've already forgotten what that meant because Marcia told me the other day. Registered nurse, licensed practical nurse, certified nursing assistant, and unit clerk.
I can speak to that, Madam Chair.
Oh, wonderful. Thank you, Executive Holman.
Yeah, no problem. Just wanted to update the committee. We've spent a lot of time on this discussion, actually. Just there's a variety of approaches we've been entertaining and kind of assessing how they would play out. Obviously, we're looking to follow the grant guidance that's out there, and that sometimes changes. But so far, we're looking to see, based on the conversation the committee had last time as well, focusing on a narrow definition of any of this, since there are countywide implications. But beyond that, there are some budget issues as well, just because this year the county has a pretty sizable deficit. I mean, we're managing that, but we've got questions in terms of longer term pieces based on the countywide implications, since it would be a county policy, at least for the COVID-19 response. And the healthcare center is also currently in a place where for 2021, it's going to need the entirety of the referendum funding plus a little more. And so just wanting to be sensitive to that, but more specifically, in terms of narrowly defining things, we're also looking at what is the specific instance of, say, direct care or interaction with COVID-19 patients look like in different areas, just because we know that if we put in a hazard policy for the county, this committee's looking at it for these positions, but there would be potentially others in the county, and seeing what would it look like for them and how would you define that again based on some of the guidance that's out there. But there's some questions just on the funding for that TAC, only because the state and the feds have deadlines on when this funding can be used, but pretty much everybody understands and appreciates that the virus isn't going to be gone when those deadlines occur. So we're looking to get some information on whether or not some of those deadlines will be extended. Chances are some of them will. So that's some of these definitions are looking forward a bit, just because to date, the policy wouldn't necessarily apply to many people, if any, but it would be there in the event that it did. But again, that's looking at whether or not funding is available if and when that took place. So essentially, we're continuing to look at those paths, looking at what the funding available can support, but also maintaining, keeping in mind that we also, the COVID-19 grant support that we've received from the state and feds is specific to that, but we want to make sure we maintain those funds, just because the virus isn't going away. And just, as a for instance, we have some questions around testing availability, because currently the healthcare center, needs to spend approximately $7,000 a week for testing. If there were other options available, maybe that number comes down, and that would help inform the discussion. So testing options are popping up. Hopefully we're going to start some next week if we can get the test kits. So that will, thankfully it's not a real budget tied item, so we have a little bit of time to get some resolution on some of these open-ended questions. But we're going to get that clarity, and then also, as I mentioned, on the funding extensions in the next month, and that will help kind of finalize what we can bring back to you in terms of what's realistic or plausible based on the discussions we've had.
Chris, when do you think that might happen?
Well, the granting piece, my sense is that it's going to happen relatively soon, just because every county in the state is asking the same question. For the testing options, we've got those set up. It's just a matter of integrating or seeing how the staff would integrate into those testing options. That if we can get the tests in from Exact Sciences, then we can start running these testing options, 3 days a week. A couple of days would only be half days, but in any case, there would be a regular kind of standing opportunity, which might be able to address the question of, do we have enough funding to cover the testing that we want to make sure is there in PPE, but also address something like this.
Thanks, Chris. Any questions for the executive from the committee? Anyone in the room? Anyone online? All right, thank you so much, Chris. Appreciate it.
You're welcome.
And I appreciate everybody putting work into this. It's an important thing, I believe. And it's, everybody's busy, and but finding a way to add additional support to those hardworking people, I think, is important. So thank you. We'll have more on probably the next agenda. Just briefly, the question from Ms. Rappi asking about financial analysis from CLA. Once we've narrowed down the options, that's when we'll start getting the financial analysis. So whether we exit the business and sell, whether we regionalize, whether we stay on our own and build our own amenities, those are the decisions this committee will need to make, and the financial analysis will follow. So, good question. All right, reports. I don't have anything, so I will pass it off on to our administrator. And Marcia, if you want to come up to the microphone.
Well, thank you, everyone, and I think brevity will be my word tonight. We've had great information. I want to thank you for the team that's here tonight, for our committee, as well as for everyone at the Annex that has been working diligently for us. In my overview, I just wanted to let you know that with the COVID-19 extending, the way we're approaching our walk every day, we're calling it, I think, the compassionate approach to COVID care, the team has gone above and beyond. To say they're heroes is certainly even an understatement. I wanted to bring you up to date in that we are now operating with 2 wings, Timber Trail as well as Hillside Meadow. That transition went extremely well. We had 3 team member positive tests. The third one closed out late last night. I was so excited because that put us in the window for opening up admissions. Unfortunately, we did have a 4th. Again, all very successfully mitigated with no impact on our resident care, and our residents have been COVID-19 free, which to me is so key. So in that compassionate walk, we're also doing a couple of things internally with the coordination of Tammy, who served as our infection preventionist. We've been testing twice weekly, which is currently a requirement with both our internal occurrences as well as the requirement when our county is in a situation above 10%, which we have been most recently. And now Tammy's asked us, which I find very supportive, to do the 2 times weekly resident testing. So that will up us just a bit on the numbers of the $6,900. However, we hope to be able to take advantage of some of the community testing. So I'm hoping that that will kind of continue to be neutralizing. I also want to say that we've had an amazingly supportive role with our family members, much communication. We're in the process of winterizing our window visit scenario and preparing for the holidays. I thank everyone very much for that, as well as looking at some of the strategic things. I was pleased to hear us all hear from Michael Loy that the regulatory world is changing. The semi-private rooms, anything shared for the future as far as precautions probably will never exist again. And I think it was amazing that McKnight featured a commentary by CLA saying the next 18 months we can strategically count on no growth for the skilled world at all, and then after that it will be guarded because everyone is finding that community placements are working very well for them. So I want to sympathetically and yet realistically say we could not be acting at a more appropriate time, but the nature has to be rapid. Again, just small but big things within our older maintenance some electronic things today with us only, our front door entrance is non-functional, and Alan was working diligently, just old product. We knew we needed to look at that, along with trying to start up and balance our boiler situation. I know everyone is aware of those needs, but I always want to be present to the community, to the committee, to answer questions on how this team is making it happen, citation-free and at a 5-star level, because they're doing it in just a manner that amazes our management team every day. And then I want to conclude by saying that as we go into our next meetings, although it would need to be virtual, I'd always be happy to share different things that we could do electronically on some of the things that we talk about internally that I think are key elements for major capital expenses, from the front door entry and things of that nature to things that we're facing with our HVAC and our heating. So although we can't have people on site, we can do lots of wonderful things, and just be there and available in any way, especially for questions today, Melissa.
Questions for Marcia from the committee? Folks in the room? Anyone online? And someone has chimes. So it sounds very nice. Just challenge right now. All right, thank you, Marcia.
Thank you, everyone.
And our next item is our business manager, so Lynn.
I just wanted to give a brief overview of what the budget for 2020 and 2021 will look like. I want to say thank you to Jenny Josie. We had a good discussion on the budget, and I certainly appreciate her knowledge. She has a lot more history on the trends of the healthcare center, so thank you, Jenny. So the tax levy for the 2020 budget was just shy of $996,000. We were fortunate. We had received about $125,000 in extra state funding that we did not anticipate. We received over $483,000 in federal funds this year due to the COVID. And so really our deficit this year for 2020 would be about $1.6 million. Looking at the budget for 2021, the deficit is going to be about $1.8 million. It's based on a census of 50. We have seen a significant decline in census. Some of the increased areas were the IT services, medical supplies, and depreciation. And I did want to just clarify or reiterate that the cost for the COVID test is truly $6,900 a week, that it was not a misspoken. That cost, $6,900, is for 300 tests, and doing staff and residents, that's about what we do in 1 week. So for the 2020 budget, we added an additional $83,000 for COVID testing. I don't know how long that will continue into 2021. Right now, we have been able to secure mostly free COVID testing from the state, and I will continue to ask. But at some point, they probably will not continue to provide those. Right now, I think we're getting them because we are considered an outbreak. So I think that's why we're getting the supplies at no cost. We can go down to 1 time per week testing if the county rate goes down to under 10%, and it was at 25.9%. So.
That's a grim number. It's just a grim number.
Any questions from anybody?
And I just wanted to note for those people online that don't see the people in the room, everyone's in a mask, socially distant. We're following the protocol. You know what? It's not that hard. Because I kind of like everybody in the room, and I want to make sure you all stay safe. So, questions for Lynn? Yes, Mary Ann, if you want to come up and.
When you mentioned we've discontinued admitting new patients, is that just done during a quarantine period of time because there's been a positive outbreak by a staff member? Or is that because we've consolidated to the 2 wings?
Go ahead, Lynn, you can go back. Thank you, Mary Ann.
It's a recommendation until we are 14 days out from the last positive case. So we're following that recommendation at this time.
Other questions from anybody in the room, other than the fact that the women in the back are living this, so I suppose you don't have any questions? Anyone online? Thank you, Lynn.
You're welcome.
Challenging times. All right. Executive Holman, I didn't know if you had anything else you wanted to report. You certainly can take the time now. And he's already left, so forget about it.
Not.
Yeah, he has nothing, he has.
Yeah, call with the governor.
Oh,
So he said he had to leave.
ask him for, we are more important. So, all right, moving on. Of course, we saw the financial packet. I had it up on the screen. Anybody have any questions about the financials as Lynn was reporting them? Okay. And then we had the vendors list. Lynn, I didn't know if you wanted, thank you, Laura.
Thank you.
You're
I
welcome.
know.
Did you want to come back to the microphone and just talk about the extraordinary expenses? So we don't have to go through the entire vendor list?
So I did list the extraordinary items from the vendor list. We had purchased 25 new office chairs from Emmons. The general parts, we had a boiler leak that needed to be repaired. Permar, we are still working on getting the chapel area set up as a COVID wing, so we had to install another fire alarm. And then Ron's refrigeration, we have been fixing the freezer and the air conditioning units.
All right. Any questions about the vendor list or the extraordinary expenses? No? Excellent, thank you, Lynn. Moving on, item 14 is scheduling our next meeting, which is October 21st. We have agenda items already. Unless committee members have other things they'd like to see on the agenda?
No, I think that'll be enough.
I think it's going to be plenty, absolutely. We might see hazard pay coming back then as well.
Yep.
If anyone has any objections, or no objections, I would entertain a motion to adjourn.
So moved.
Motion by Robbie, second by Neville. All those in favor, please say aye.
Aye.
Aye. Thank you, Ray. We are adjourned at 6:07. Thank you, everyone.
A video of this meeting is available for viewing on the city's website, stevenspoint.com/videos.